As part of primary care networks, TSL Community Anchors are uniquely placed to support and encourage new community activity that helps health colleagues tackle local health priorities.
From working in this sector for such a long time, I can really see the sort of health, the public sector and the private sector all coming together now with some fantastic results and really innovative projects as well.
Projects like Wellness Action, run by local gym owner Trevor Seymour. He wanted to give back to his community and offer free charitable services to people who need them.
Everything fell into place, shall we say, and we had a bit of funding. We said, shall we do this as a pilot? We obviously worked with the PCN on it so that they refer people to it. We managed to get some funding together if people were struggling to travel as well. So we tried to remove every barrier that there was, and it's going fantastic.
So the way it works is they come here, we test their blood glucose, we test their cholesterol, the blood pressure, peak flow. So we do all those checks to start with. We give them a food diary, which is an opportunity to write down every single thing that they eat throughout the week. When they come back to the next meeting, we'll talk about that. And I can say, how can we improve that? So it might be a spoonful of sugar on the shreddies. Why do we need the sugar on the shreddies? So if we can make some quick wins like that, we will help get their blood sugar down. And then every other week, we actually cook. So we go downstairs, they sit in the kitchen with me, and I'll make something like a spaghetti bolognese or a chili or a chicken tikka, but I'll make it in such a way that it's low fat, no sugar, no dairy, no gluten, and it will be healthy option food so they can go away and hopefully educate themselves and cook for themselves.
And up at the Chestnut Centre, they're running a similar community-led programme called Eat Well Move More that's been successful in other parts of Kirklees.
And it's all about looking at ways of eating better and hopefully helping to reduce our diabetes. So this is the start of a longer course all around eating better and moving more. Most people can cook, but what we're looking at is cooking from scratch. So starting again, eating more fruit and vegetables, making sure that our dishes are reducing in salt and fat. And then today we are having a pudding, but actually it's a fruit yoghurt ice cream. So quick, easy things that people can make.
And while people are there, they can pop down the corridor to have their average blood sugars checked. This is the sort of test that you'd normally go to the doctors to have.
People don't always want to go to their GP practice. If they can pop in the local area and have a test that takes 3-4 minutes, it's ever so quick and you get the results right there and then we can offer further advice about what would happen if they were pre-diabetic or diabetic.
This community testing is taking place at different community centres and libraries across the PCN, following on from an earlier trial in local pharmacies.
And we picked up a 6% rate of pre-diabetic and diabetic patients who didn't know that they had pre-diabetes or diabetes. Diabetes is on the rise. Pre-diabetes, our numbers are increasing all the time. And if we can pick up people who have a high HbA1c and we can change their lifestyle, we can prevent it moving into type 2 diabetes, which in terms of personal health can make a huge difference.
We're going to have a diabetes coordinator working here that's going to try pull everything together, look at different pathways, more local pathways for people to sign up to, and obviously also the preventative work as well, which is as important, if not more important, to stop people becoming diabetic.
I've now got a group of people that come in before the session, exercise, then come into the session. We met a guy today who has actually got rid of type 2 diabetes, completely got rid of it. He had a knee operation and he wasn't able to exercise, so he had to eat better. He was eating too much sugar, he was drinking too much booze, he was doing all the wrong things. So he's really trimmed back on what he was eating, and he's now no longer type 2 diabetes, and he's lost the weight as well. So he's in great shape.
Usually the feedback's really positive because people love food, and these sessions really, as well as sort of learning to cook, people are sharing their own ideas. For some people it's getting out and about and realising that cooking is a lot easier than they thought.
We've got one lady that was at the meeting today and she's lost 3 stone from the time that I met her She's also got rid of her type 2 diabetes, and she's not taking any medication, so I proved that this will work.
It's totally changed my life, basically. I've never been so fit. I'm practically running up the hill taking kids to school. So yeah, it's been a good thing, you know, for me.